here's a fun fact. We didn't know the full anatomy of the clitoris was not discovered until 2005.
Oh gosh, I'm in pain. That hurts. What?
2005 was the first time it was published.
Welcome to Up One, the podcast where we take a deep dive into the science behind supplements, therapies, and diagnostics. I'm Sawyer Stone, your guide through the maze of health claims, here to ask the big questions.
And I'm Dr. Bill Andrews. With decades of experience in medical research, I've dedicated my career to uncovering the real science behind disease, aging, and human health. On this podcast, we don't just skim the surface of scientific studies. We conduct a critical meta-analysis, separating credible research from misleading conclusions.
There's a lot of noise out there, conflicting studies, bold claims, and endless marketing. Up One is here to cut through it all and bring you science-backed insights that you can actually trust.
We're talking prevention, diagnostics, treatments, and the big questions shaping the future of health.
If you're serious about understanding the science of health and longevity without the fluff, let's take it up one. Okay, hey, Dr. Bill. And we have a guest today. We'll introduce her in a moment. We're going to talk about our decline in sexual health and why it's a major concern for many men and women as they get older. How do we prevent it and how do we restore it? You have recommended Dr. Amy Killen to be a guest on today's episode of Up One because she is the world's leading authority on the subject as a very well-respected speaker and educator at medical conferences, attended by physicians wishing to be way more helpful to their patients than they can on their own.
This is a very special episode for me because I've always been amazed at the remarkable power of mutual intimacy to correlate with people being biologically younger as they become longer lived. And it's regardless if they're woman with man, man with woman, or woman with woman. And I want to point out, we're not talking about just sex. Even hugging and kissing provides benefits that improve health. And I also want to say, it's not just about reproduction, since most of the audiences that I see at conferences on sexual health are people that are beyond their reproductive years. I'm actually quite honored to have Dr. Amy Killen, who I consider to be the world's leading expert on the field of sexual health, as a guest on our podcast today. So I'm looking forward to this.
Well, thank you. I'm happy to be here as well. I've known Bill for a few years through conferences. I think we were talking, it's probably been 5 or 7 or 8 years since we first met.
10 years
a long
ago.
time.
Yes.
Yeah, well, thank you for joining us today, Dr. Killen. Well, Bill, before we get going, are you saying to me that there is a tie between sexual intimacy or intimacy in general, physical intimacy in general, and living longer and longevity?
Yes, and I think Amy can address that better than I can, but there's a lot of correlations, but there's also changes that occur that are actually decrease the rate of aging and stuff like that. And I'll let Amy
Yeah,
fascinating.
I've learned most
Wow,
of it
I'm
from
so
listening
excited.
to her talk.
It's very interesting. It's not talked about a lot, but there have been some big studies. There was a study in 2020, which was 15,000 plus U.S. men and women, and they looked at the correlation between sexual activity in that case and longevity. And they found that people that had sex at least once a week had a 50% lower all-cause mortality rate compared to people who were not sexually active. And so during the course of the study, they were 50% less likely to die during that 7 or 8 years of the study than other people. And this mirrors findings from other studies out of Wales and libido studies out of Japan. So we know that there's, like he said, a very strong correlation. It doesn't necessarily prove causation, but we know that sexual health kind of sits at the middle of all different other types of health, like physical, mental, emotional, social, partner, spiritual, environmental. All of those things influence sexual health. And so we know it's a good biomarker of health, and it also probably contributes to overall health as well.
Awesome. Well, I'm excited. I'm excited to talk about this. So the first thing we should probably talk about is why is talking about sexual health so important to talk about? Why does it need to be part of our vernacular? Why is it important to talk about at all ages? And why is it even more important to talk about as we continue to grow older?
I think that to me, sexual health, it doesn't even require that you have a partner. To me, sexual health is not about them. It's about you. It's about the health of your hormones, the blood flow, getting down to all the different nooks and crannies. It's about, your nervous system being healthy and being able to get into the parasympathetic. It's about the health of the pelvic floor organs. So to me, it's not even necessarily about having a partner, although certainly there are benefits to the intimacy part that we know as well. But sexual health doesn't even require a partner. If you ask me, it's still important for people to think about.
So solo stuff still making you live longer.
Yeah, I mean, we don't know for sure. We think that any sexual activity, orgasm, all of those things have some of the same benefits, if not all of the same benefits as partnered sex. Probably not all the same benefits, but we still get a lot of the same neurotransmitters released and the same hormones. And certainly just making sure that you're staying healthy enough to want that and to enjoy it. That's all also very beneficial.
Yeah. So I guess in a way, then you're saying that the emotional portion of being with a partner in that way is beneficial to longevity, not just the action or the exercise of the sexual act itself.
Yeah, I think there are two different things happening, certainly. And like Bill said, holding hands, dancing, cuddling, we get a great oxytocin boost from just those things. And we know that oxytocin is directly sort of opposing cortisol in the body, and it's helping to protect the brain from cortisol. And so that alone probably has a lot of longevity benefits. So I think that the intimacy part, whether that's with friends, whether that's dancing, whether that's just sitting on the couch and watching Netflix, but like touching each other, like that has benefits also, but then sex and sexual health in a different capacity also has benefits, we think.
Let me add,
Awesome.
I mean, just reducing the intimacy reduces stress, and we know that stress accelerates aging. And also, Amy just mentioned, or Dr. Killen, I'm going to call you Amy.
You can call me Amy. Amy's totally fine.
Amy mentioned that the cortisol levels decrease, and cortisol is an indicator of inflammation, and we know that inflammation causes aging. Most people think cortisol is a bad thing, but actually it's there to fight inflammation. So,
yeah.
Okay. Well, can y'all tell me why sexual health declines in men and women as they age?
Well, I mean, it doesn't have to decline, but the reason that it most commonly declines for women, the thing I see most often is that when women go into menopause, their ovaries, which are producing their estrogen and progesterone, are going to be, kind of fading out, and that you lose those hormones, which is really important. Testosterone is also going down in men and women starting at about age 25, and that's very important for sexual health. So the hormonal piece is a big driver. And then, I think other things too, as you get older and you get medical problems, you get illnesses, like other things kind of prevent you from being interested or even able to be sexually active. Because if your knees hurt too bad or your back hurts too bad, it makes things not quite as sexy.
Yeah. Yeah, for sure. Okay. We just had an episode we recorded on menopause, and that was very fascinating to find out all of the little intricate details that go along with that. And my peer group is going through menopause right now. I'm quite a bit younger than them, but it is so fascinating to hear them talk about, like, in their marriages, what's going on with their sex lives and all of it being affected by hormones. It's so fascinating to watch that. And we all know it's happening, but it still feels like it's brand spanking new, and it happens to somebody and it happens to you. And it's like, it's so fascinating.
Yeah, even when you know it's coming, like even if you know what's happening out there, like when it happens to you, you're like, wait a second, this is not supposed to happen.
Yeah, wait. And it's like, aren't I supposed to be like the exception? Am I supposed to enjoy freedom? Yeah, from all of these issues for sure. Well, are there any like lifestyle or dietary choices that men and women can make that might help them maintain their sexual health? Is, exercising in a more like traditional way more common with people that have sexual health longevity? Or tell us about it.
I mean, when I think that I'll step back a little bit. When I think about sexual health, I think of kind of like the four pillars of sexual health. And I think about the mind. And of course, that's going to be mental, emotional, past trauma, spiritual, like anything that's kind of like up here. And of course, your brain is your largest sex organ, and it's probably the most important. That's a big piece. So anything that's good for mental and emotional health is going to be good. And then I think about the hormones, which we kind of touched on a little bit. And I think about blood flow because you need good blood flow to the sexual organs in order to have normal responses. So anything that improves blood flow, which is going to be anything that improves cardiovascular health, is going to improve sexual health. And then the last pillar is the actual pelvic, kind of support and pelvic organs themselves. So if you kind of think about it that way, I mean, certainly anything that's going to improve your cardiovascular health is going to help sexual health. So like, for instance, eating nitrate rich foods, green leafy vegetables and kale and arugula and things like that are going to be good for blood flow because we know that that's a mechanism for improving vasodilation. Certainly exercising, both heavy lifting and aerobic exercising is good for cardiovascular health. So it's good for sexual health. So you can kind of extrapolate a little bit, like anything that's good for your heart and your brain is also good for your sexual organs.
That makes sense. I was going to ask you because you said that the brain was the largest sexual organ. And, I think that might be the first time that I've heard that.
Yeah. I mean, the brain is where like desire and arousal and orgasm all kind of start. And that's where all those things go to die too. Like if you're having a lot of stress, if you don't like your partner this day, if they didn't do the dishes, like this is all, this all comes from the brain. It's not so much the rest of the body that's in charge here.
Yeah, that's just fascinating. That caught me. I was like, whoa, I've never thought about it like that. But it totally makes sense. Well, Dr. Bill, do you have anything that you want to add on the dietary portion of things and like what might be able to get? I mean, just because they say there's so much cliche about like oysters and whatever else they call a food aphrodisiac. I mean, is it even true? Is it helping? Is it just a myth? Is it per person?
Well, just the increase in nitric oxide synthase functions and like nitrate and like arginine. Arginine is something that is often touted by cardiovascular doctors as a way to keep your blood flow for cardiovascular disease and stuff like that. But it also helps with sexual abilities and things like that too.
Mm-hmm.
Yeah, like arginine, L-citrulline, which is in watermelon. These things can be helpful especially in younger people. They're not quite as helpful in older people because you still have to have intact blood vessels, healthy blood vessels to make some of this. And you also have to have healthy bacteria in your mouth and healthy stomach acid. There's a whole lot of things involved. But yeah, certainly, I don't think that in general foods are going like oysters. I don't think there's good evidence that they're going to like make you super, I don't know, sexual. But I think that having a healthy diet in general is going to be better than not having a healthy diet in general.
That makes sense to me. Okay. Well, all right. So if someone, has a loss of sexual health, is there a medical treatment that might be available to restore that sexual health? Are there different medical treatments for men and for women or all other folks on the spectrum? Like, what do we have that might be able to help in that situation?
Yeah, I mean, first of all, obviously figuring out what the cause is going to be important. So, dialing in where it's coming from. But like specific things that target like the pelvic floor, for instance, one of my favorite therapies is low intensity shockwave therapy, which is it's a device that's been used for decades. It's been primarily used for like improving like musculoskeletal healing, like rotator cuff injuries or, fasciitis in your ankle. But it was discovered about 10 years ago that this is a machine, like doctors hold it in their hands. And it's really effective for improving men's erectile dysfunction. And so we have a lot of studies now, and a lot of urologists are finally doing it. I've been using it for 8 or 9 years, but that this is helpful for actually kind of turning back the clock a little bit and helping to improve the health of the smooth muscle cells and the blood vessels in the penis. So it's mostly research in men, although there is some research in women. It's not as much. And, in general, women don't get research as much in the sexual field space. Which is unfortunate, but I think that it applies to both. And I think that we can use it, for everyone to help, that are people who are having blood flow problems or pain problems can benefit from this.
Okay. Well, and I know just because I have this peer group that the pelvic floor therapy is like, I mean, not only a game changer for their sexual health, but a game changer like across the board. And like maybe possibly we should be doing it from like a very young age throughout our whole life. And it's not as, I think it's like maybe a new idea or maybe it's just new to me. I don't know.
Yeah, it's so interesting. I think a lot of, and I think this is talked about more in women than men, but certainly it's important for everyone. But, just understanding the way that the pelvic floor muscles, which are kind of this bowl of muscles, that they actually they interact directly with all the rest of your core muscles, your abs, your obliques, your back. And then they also interact with your diaphragm. So everything from how you breathe to how you sit up to whether you hold your stomach in if you're, at a party for many hours on end, all of these things can affect your pelvic floor health and whether those muscles are too tight and dysfunctional or they're too loose and dysfunctional. And so I absolutely agree. I mean, having a good physical therapist, like a pelvic floor physical therapist that can kind of help diagnose problems and then giving you things to do at home can be a game changer for people who have any kind of pelvic floor problem, which there's a lot of people.
Yeah, that's fascinating. Now, you said earlier that it was unfortunate that there's not as much research done for women. And we know that like across the board, that is the theme and not just sexual health.
Yes.
Do you know of, just in the sexual health arena, is there a reason why there isn't more research done on women, or is it just like the same thing across the board? There just isn't any.
I think it's both. I think that it's that women in general weren't even included in research until the early 1990s, by the NIH. So we were left behind quite a bit. Yeah, here's a fun fact. We didn't know what the full anatomy of the clitoris was not discovered until 2005.
Oh gosh, I'm in pain. That hurts.
2005 was the first time it was published. Like not just that it's a little nubbin, but there's like a whole like thing back there. So we've been left behind. But also, I do think it's also more difficult to study women because we don't see, men and women have erections, but we don't see women's erections because they're mostly inside. And so it's harder to measure those. It's harder to say if something is working or not. Like we can do ultrasounds, but you have to go to the doctor. Like, a woman doesn't necessarily know if she's got good blood flow or not, whereas a man does. And so I think that makes it a little more complicated as well.
Mm. Man, I can't believe that.
We talked about medical interventions a little earlier, and I was thinking you were going to mention something about stem cells. What do you think about going on with stem cells nowadays?
I mean, I like stem cells as well. Stem cells and regenerative therapies, extracellular vesicles, exosomes, for sexual health for men and women. We have more research on men as well. This goes back to that question, in terms of being able to improve sexual function. I think the combination of shockwave therapy and regenerative injections, like, injecting into the penis, injecting into the clitoris, the vaginal wall, these things in combination with shockwave can be very effective, but we don't have a lot of research in women at this point still.
Man, disappointing.
Okay. I know.
Well, to go back a little bit to what we can do diet and lifestyle wise, are there supplements that can be taken to help either maintain or restore sexual health?
My favorite supplements are the nitric oxide boosters. Like there are a couple of brands that have done the research, like Dr. Nathan Bryan, who speaks at a lot of events that we speak at, has a couple of different nitric oxide boosting supplements with some good clinical studies behind them for reducing blood pressure and then improving blood flow. And he's also looked at sexual health as well. And I think in men is what he looked at. But so I like those for supplements. And then I think just generally keeping your hormone pathways healthy, your basics, your vitamin D, you're making sure you got zinc and selenium and some of the basic things that are needed to make hormones like testosterone and your other sex hormones is important. Most people have enough of those, but not everybody.
Yeah. Yeah, I'm finding I'm on this journey personally for myself with PMD, which is premenstrual dysphoric disorder. And I'm just finding that it is the out of whack hormone thing is truly insane. And like, if it dips even just a little bit, like you feel like a different person that like your body is not familiar with. And it is crazy to me that I don't know, maybe there's just not a lot of discourse surrounding it in my life, but it feels like nobody's talking about it. It feels very important.
Dr. Jolene Brighton's writing a book right now, I think, and I think she's talking a lot about PMDD. She's has had great books, but it is true. I think that, one of the things that I tell women is that like, there's so much information that we can get from just your cycle. Like, is it normal? Is it painful? Is it irregular? Does it cause you to have headaches? Like, there's so many things that I think women are just told, oh, you're fine, suck it up. But, that's kind of like the story of our lives. But I think that we should probably listen to these symptoms and maybe chase them down.
Yeah. Yeah. I'm finding that I'm a much better person inside and out, finding out more things about PMD than I am just leaving it be.
Yeah.
Okay. All right. So, Dr. Bell, maybe you can help us out with this one. From a longevity perspective, how does mitochondrial function directly affect libido and stamina as we age? And then my second question to tag on to that would be can certain supplements boost the cellular energy for better performance, or has that already been answered by our nitric oxide supplements?
Well, let me address the first one first. Now, there's a question about the definition of libido. Now, I've always considered libido to be more mental, okay, not the physical part.
Yeah.
And so I don't know how mitochondria would play a role in the mental aspects of libido. But
I see.
But in terms of like the fact that mitochondria are providing energy, that's energy is needed for most of the sexual responses, including just regular intimacy.
Yeah.
But like urolithin A is a really good thing for helping boost mitochondria. Nicotinamide riboside, a bunch of other things. But of course, I'd be interested in hearing what Amy has to say on the subject of mitochondria.
Yeah, and I think I think so. I think the libido is kind of desire, that is more brain, but then arousal is the actual blood flow. That's the blood flow and the kind of physical response to that as a more arousal. But I think about mitochondria as being really important for the making of hormones. For we know the ovaries, for instance, are one of those mitochondrial dense organs in the body, and they make estrogen and progesterone. Certainly your other glands are going to have mitochondria. So I mean, if we think about libido is highly tied to testosterone and to estrogen in women, testosterone in both. And so we need to make sure that we're making those hormones, and healthy mitochondria can help with that. But I think, just in general across the board, obviously all of your organs have mitochondria in them. So when you think about all the other things that are required for arousal, for blood flow, for healthy blood vessels, like mitochondria is like at the root of aging. It's one of the major hallmarks of aging is having healthy mitochondria.
Okay, great. All right, well then let's talk a little bit about hormones again. Just go back a little bit to that. We talk about testosterone and estrogen in the way that we talk about it for lifespan and longevity in general. But how did these sex hormones, which is what they would technically be, even at low, healthier levels, continue to regulate vascular health and neurosensitivity that are crucial to a sex life? So I know we talked about that sort of a little bit. Maybe y'all could dive a little bit deeper into that. Yeah,
I mean, certainly they all affect the brain. They're all estrogen, progesterone, testosterone in women are all going to drive or affect, libido and arousal and orgasm. Testosterone more in men. And then we also know estrogen in men and women and testosterone in men are directly responsible for a lot of the blood vessel effects. So you have vasodilation, estrogen in combination with nitric oxide opens the blood vessels up so you can get blood flow to the right area. In men, testosterone also has a role in getting blood flow to the penis. So it's not just the mental, emotional kind of brain effects, but actually systemic effects. And those hormones also help keep the sexual organs healthy. So for instance, in men, testosterone is needed to keep the cells in the penis like elastic and stretchy and like not having them turn into scar tissue or fat. You have to have testosterone for that. And in fact, men who have like low testosterone over time, the penis, instead of having these smooth muscle cells that are stretchy and normal, they'll get fat or they'll get scar tissue in there, which is going to cause erectile dysfunction. And then in women, if you don't have estrogen, the same kinds of things happen. You essentially get, shrinking, dehydration, bad microbes growing. Like these hormones keep the structural health of the sex organs as well.
Yeah.
And there's also the hormones that are a result of intimacy, like oxytocin and HGH. And I don't know if Amy's got any comments about those, because they're
yeah. Yeah, we get dopamine, we get serotonin, we get endorphins, which are going to be kind of like your runner's high. We get oxytocin. We get all of these things from like a normal sexual kind of response. And with, I tell people, in order to get kind of the same cocktail of hormones and neurotransmitters, you'd have to, strap like a puppy to your chest and go for a long run while popping Prozac and snorting cocaine.
Oh my gosh. Yeah.
That's the cocktail you
Okay.
get.
Yeah.
And by the way, I don't recommend that, but
Yeah, it doesn't sound good for the puppy's health to be jostled like that. That's hilarious.
Like
Okay. It's quite
HGH
a cocktail.
actually helps with skin. Okay, so skin
Yeah,
elasticity and just appearance in general. So there's also those
man.
benefits.
yeah, true.
I'm just gonna tell my partner, like, this is gonna make us both younger. We just need to stay committed to this.
Yeah.
Good.
Just
Good
suck
to
it
know.
up.
Just suck it up. I know it's so hard to do. Okay. Well, is there any emerging research that connects health and the balance of the gut? Because you just mentioned this, Dr. Killen, microbiome to hormonal balance or overall sexual vitality.
I know that there is some emerging research with the vaginal microbiome. There's some companies out there like Evie, which is Naveen Jain's daughter, Priyanka, has that company, and they're doing a lot of really interesting research on the vaginal microbiome and its connection to, all different things in the longevity space, as well as just the general health space, looking at connection to polycystic ovarian syndrome or preterm birth or infertility or probably PMDD and all of these things. And that's one of those areas of medicine that like we've just really not looked at. But it turns out that the bugs that are growing in your vagina are actually just as important as the ones growing in your gut.
Yeah, that's so
As
fascinating.
gross as that sounds.
Yeah, no, but it is definitely that. It's just funny that it is bugs. That's funny. Okay, well, okay, so if we think about, a healthy body, we think about a body that doesn't have a lot of inflammation. And so my assumption is that the inflammation directly affects sexual issues, just like it directly affects other health issues. And it can lead to issues, or maybe does it lead to issues like pain or erectile dysfunction in both persons? And what is the strongest anti-inflammatory supplements that target that area specifically for sexual health, not like something like turmeric that might target joint inflammation?
I don't know if there's a specific anti-inflammatory agent that I've seen at least studied for sexual health. I think anything that reduces inflammation system-wide is going to potentially, improve sexual health by improving blood flow and cardiovascular health, as well as potentially the, actual organ health. But I don't know if there's something specific, and maybe you know, Bill, but I don't know any specific sexual health.
I've never heard of anything, but I just can say that inflammation is major cause of cardiovascular disease, which causes sexual performance issues.
Yeah, for sure.
Yeah. Okay. If a couple is focused on extending their health span together, are there specific foundational supplements beyond just like a multivitamin that both men and women should prioritize to support a mutual fulfilling sexual health in their later years?
I think there's not necessarily one thing, but certainly, by supporting the health of all the rest of your body, then you're going to be supporting your sexual health, because we know there's so many aspects that go into that. So it's not necessarily, I don't think there's a single component, but it's, supporting cardiovascular health, maybe with your omega-3 fatty acids, and you're, making sure you're getting your micronutrients, your vitamin D and magnesium and, selenium and things like that, are going to support your hormone production. So, your B vitamins is going to be important for hormones as well. So there's a lot of things that are important for just general health, but I don't think there's necessarily one or two things that are just good for sexual health.
Yeah. It sounds like as long as you're maintaining every aspect of your body and trying to keep every aspect of your body, both mentally and physically healthy, then you're going to attain sexual health and wellness as well.
Yeah.
It doesn't sound like it's
usually
really
unless you
specific.
have like trauma or something to the pelvic floor, unless you have like specific things that have caused issues. That's the whole thing, is that sexual health is kind of a portal for us to be able to look and help you optimize all the rest of your health in your body just by kind of looking at in through sexual health.
Yeah, that's fascinating. Okay. Well, some of the conversations that are that are about sexual health between patients and providers is taboo or hard to talk about, or folks have some shame, or folks have embarrassment. Is there a way, Dr. Killen, that you have found that might be able to help us make that less taboo or less embarrassing or less shameful? Like, how do we not normalize, but how do we add it to this vernacular that we talk about regularly so it doesn't have all of these aspects of not fun to it?
I mean, for me, it's just continuing to talk about it. Um, and not, and not make it a big deal. Like if I'm talking to a patient, I'm going to ask them about their, are they having chest pain, any issues with, brain fog and migraine? Like I'm going to ask about their elbows and their knees and their joints. And I mean, I should also be asking about sexual health. So to me, it's just one more system that is part of the body that is important. And if we name things properly, if we don't make it a big deal, like, my kids, that I've been talking about sexual health to my kids since they were young, like not in a creepy way, just in a like, this is what's happening in your body way. So we can do the same
Yeah.
thing to adults, I think.
Yeah. That's true. That's true. That's a good comparison to be like, if you can chat about it with kids, then most certainly you can chat about it with adults because, everything in life with kids seems to be a bit censored. Okay.
No, we haven't talked about telomeres yet, my favorite subject.
Yes. Why don't you talk about telomeres, Bill?
I thought maybe everybody's waiting for me to bring it up, but because earlier in the podcast we were talking about the causes of sexual decline and things, and I believe that telomeres probably do play a major role in, like, the fact that our serotonin and our endorphins and our what's the other one, dopamine, those decrease with age, and it's probably very likely that there's the role that telomeres play in the epigenetics of gene expression, stuff like that throughout the body, that's playing a role in there. And so I think that lengthening telomeres is going to be something that's going to be a major help with sexual performance and intimacy and things like that. But not only, I mean, so I don't know, Amy, if you're familiar with Elisa Epel, she's a good friend of mine who's at UCSF, works on telomeres and psychology mostly. And she's published a study, I want to say like 5-6 years ago or something like that, maybe 8 years ago, 10 years ago, on the fact that when she looked at telomere length in especially women that were intimate, more intimate they were, the longer their telomeres were.
Yeah,
I mean,
I think I saw that study. I remember that study.
Wasn't lengthening telomeres, but there was definitely a correlation between the fact that not only can long telomeres help with sexual performance, but also sexual performance can help with telomeres, keeping telomeres long. And then most likely that's all due to reduced stress. Okay. Being intimate reduces stress, and stress causes accelerated telomere shortening.
Yeah, that makes sense. We know that there is a strong correlation between, people who are, in healthier sex lives, they have healthier sex, they tend to have certainly lower blood pressure, less stress, less depression, less anxiety, better self-image. There's a relationship between sexual health, even and immune health, and telomeres as well. So I think that the stress piece of it probably is like you said, it's a big contributor to both, improving mental health and emotional health, as well. We also know that couples who stay sexually active tend to have less cognitive decline as they get older. So they actually tend to have less shrinking of their hippocampus in their brain, and less kind of memory problems. So there's a lot of these benefits. We don't necessarily know how they happen or why, but I think it's pretty fascinating.
There's benefits to the immune system too, and nobody knows why.
Yeah. Yeah.
That's so fascinating that it connects to all of these aspects of your life, but we're not quite sure why. That's so fascinating that it helps you maintain great immune health. That is so interesting.
I mean, the immune system makes sense though too if we look at it just through the lens of stress, because we know that if we can reduce stress and cortisol, then that's going to be helpful for the immune system. We know that stress is a major driver of almost every disease. So if we can reduce stress, then that's going to be beneficial probably to most areas of our body.
Yeah, man, that's awesome. Okay. Well, are there any common myths concerning sexual health that y'all have come across that you want to come on here and myth bust?
I think one big common myth is that that sexual health has to decline with age, that you're supposed to just kind of stop being interested, stop having sex, stop having intimacy as you get older. I don't think that is, certainly if that's your choice, but I don't think it's something that has to happen. We have many ways that we can help prevent that now. I also think that it's a myth, like I said before, that you should only care about sexual health if you have a partner or plan to have a partner soon, because it's not about them. It's about you. And then I think the third myth is that if you have a sexual problem or lack of sex drive or whatever, that you don't have any recourse, that there's nothing out there that you could do, that you're stuck, too bad, because that's totally not true. We have many, many tools at this point.
That's the main thing that I wanted to talk about in myths, is that and when I go to conferences and talk with people that are like over 50 and things like that, they believe there's absolutely nothing they can do about it. And I say, you should go listen to Dr. Amy Killen talk. Okay. And because it's amazing what you don't have to go through all this when you listen to the things that she has to offer.
Yeah.
Dr. Killen, do you have anything that you definitely want to talk about, or that's something like a soapbox you usually have a chat about?
I think the main thing is just to let people know how much power they have. Like, you have so much power to create health, certainly to avoid disease, and that health includes sexual health. So, the doctors, we can help, we can do fancy tests, we can kind of put you on medications if you need it. But really, most of the control is in your own hands, and it's just learning about what you can do on your own.
Yeah. Okay. Dr. Bill, anything that you want to add? Anything you want to talk about or discuss?
As I said, I think this is a very special episode that I hope people listen to this, because I think that the lack of intimacy when you get older actually accelerates your aging. And a lot of people, like social isolation is a terrible thing for people when they get older. It really causes a decline in their health and things like that. And so if more people would be listening to podcasts like this, I think the world would be a happier and healthier place.
I like it. Agree.
Yeah, I like it too. Yeah, it's definitely something I see in my peer groups, and when like folks are going through specific things in their relationships, and like they've got like a sexual health or a sexual intimacy drop off or whatever it is, and then I see them a few months later and they've got it back in their life. It's like they've spent like a week at the beach and they're like sunny and bright and their skin's sparkly, and it's crazy to me. It is so important, and that I'm so happy to hear that like it wasn't just a myth I had. It was a very important part of aging. Well, Dr. Killen, thank you so much for joining us on Up One today. If our listeners and viewers want to find you or have some more information about what you're doing regarding sexual health, where can they find you?
So I'm very active on social media, especially Instagram, Dr. Amy B. Killen. And then I also have a website, dramykillen.com. And I also do a lot of writing on Substack, and I have articles that come out every week that are kind of deep dives into a lot of women's health, especially women's longevity, sexual health. So find me on Substack as well.
Oh, that's awesome. Thank you for sharing. Thanks for joining us on Up One. If you found today's conversation valuable, be sure to subscribe and share this episode with someone who's curious about the real science behind health.
Have a topic you want us to break down? Send us your questions. We're here to help you separate fact from fiction.
Until next time, stay curious, stay informed, and let's keep taking it up one.